So regenerative medicine, or some people will sometimes refer to it as orthobiologics, has really emerged into the veterinary market in the last several years. And so I think there's a lot of misconceptions when it comes to regenerative medicine. Initially, and probably a lot of the public's misconception is that we're simply trying to regenerate new tissues, which, while there may be some regeneration, what we're really ultimately doing is taking a very high concentration of growth factors and anti-inflammatories to an area of relatively poor healing. Probably one of the biggest things to understand is that it's not the one-all be-all type of modality, but really regenerative medicine functions or works better with combination therapy. So whether that's with surgical therapy, medical management, rehabilitative therapy. So it's really a tool that can go into the tool belt as part of the multimodal management when it comes to conditions such as osteoarthritis or chronic soft tissue injuries such as iliopsoas tendinopathies, supraspinatus tendinopathies. And collectively, regenerative medicine encompasses the concept of platelet-rich plasma and or stem cell therapy. And while they function very similarly, there are some differences between the two. And platelet-rich plasma is essentially where we're taking a very high concentration of the platelets, which within the platelets themselves, there's a very rich source of growth factors that are going to help promote angiogenesis so we can get inflammatory and reparative cells to a site of injury. It's also going to act as a really good scaffolding. Think about when you cut yourself and a clot forms. All of those platelets are going to help hold the tissue together, but at the same time release a lot of growth factors that are going to recruit other cells and reparative cells to the area. And stem cells are also going to help with angiogenesis, but they're also going to help decrease some of the pro-inflammatory mediators, increase some of the anti-inflammatory mediators. And what's especially important for chronic conditions is it can help inhibit or break down some of the fibrous tissue that tends to develop within tendons or ligaments due to chronic repetitive overuse type injuries. So that can help then lay the groundwork for platelet-rich plasma to lay a scaffolding, so then we can then release these growth factors to get a healing response to hopefully get the tissues back to a more normal architecture so that it can undergo the elongation, distensibility, and functionality that it's designed to have.